Welcome back to another Soul of an Empath podcast. I'm Tiffany Cano, and today I have my naturopath doctor with me, Dr. Dana Churchill. I really have been enjoying receiving the different functional medicine and vitamin IVs and supplements that he's been giving me, and I wanted to share them with you guys. So let me tell you a little bit about him, and then we'll go from there. So, Dr. Dana brings to his practice a bachelor's of science in nutritional biochemistry and clinical nutrition from Rutgers University. As an undergrad, Dr. Churchill was awarded a student position with a team of respiratory neonatal researchers specializing in sudden infant crib death at UMDNJ. His academic pursuits were enhanced by continuing education at National University of Natural Medicine, where his passion for treating the root causes of the whole body while embracing natural treatments that do no harm continues to be his guiding credo. Advancements in regenerative applications and all natural prescriptions with attainable results have his patients lauding Dr. Dana as the gold standard in natural and advanced medicine. And
Okay.
yeah, and as I mentioned, I personally use him and highly recommend him. So I wanted to bring him on the show to help you with your physical and psychological health and wellness because he's great.
Really.
So thank you for being here
Thank
with
you,
us.
Tiffany. Thank you very much for that introduction. Very nice. Very nice.
You're
Yeah,
welcome.
there sure is a lot of illness and disease out there nowadays. Um,
Yes. Yeah, and it's what
Not getting any
maybe
better. Well, one at a time it is. With one at a time, or two or three at a time it is for sure.
Yes. When they come to us for help, we can help those, right? But the masses
Yeah,
still need a little waking up, spiritual waking up, so that they can also improve, right?
totally. I agree with that. Yes.
And for those who are still learning and exploring about what a naturopathic doctor, a functional medicine doctor is, can you just start with the basics?
Okay,
So
if I go off on tangents, usually I'll make it back to the main thought, but sometimes you got to bring me back. All
I'll
right.
reel you
I have
in.
too much information in my brain and it's not getting any less. Um, so a naturopath, I started out as a naturopath. I mean, I'm still a naturopath, that's my degree, but I branched into what I would call more functional anti-aging regenerative medicine, which are three different disciplines. So to not make it too complicated, let's just stick to the functional medicine. That's pretty much treating pathology and looking for the root causes of the symptoms or the problem or the disease, whatever it may be. It could be physical, it could be mental, emotional, spiritual, and I think they're all connected. You can't separate them at all if you can start to see that in people. So, we go down this path with the patient, and what I'm looking at, I've been working on myself for about 40 years. I've been clinically working on patients for about 20 years. So there's a lot of things that come into play when I see a patient in front of me. It's not as simple as when I first started, and which is good because there's a lot of cues, and there's sense. I have a very acute sense of smell and taste. So I mean, I use all my senses, and some that I probably don't even know I have when I'm assessing people. And we're looking for the root causes of the problem. We're really looking to fix the problem at the root. And now, if you could say, well, the root can go all the way back to birth. Well, yes and no, and everybody's different though. So you're going to have to assess each person differently for the way you're going to figure out what's wrong with them. And I'll just go into the physical part. Mostly we do a lot of different labs, and that's how I learned a lot of what I know nowadays is through the lab companies, kind of reconstructing or deconstructing the labs, working backwards, and to really study with those lab guys, those PhDs. They're very bright, looking at hair, urine, stool, blood, saliva, all these different mediums for what could be prevalent in the society now. And we're not going to look for Ebola in America, thank goodness. And I hope that never happens.
Mm-hmm.
But am I looking at long COVID, or am I looking at Lyme disease, or am I looking at somebody who's just been beaten down for the last 6 months because their job has gone south and they lost their job and their family's having problems, so they're so stressed out that their immune system's looking like almost like they have a virus. But so there's a lot of things that come into play here, and you need the totality of symptoms. I think Hahnemann coined that phrase,
Mm-hmm.
the innovator of homeopathy, really looking at the totality of symptoms and the center of gravity. Where does this center around? And it's usually an organ or two. It's not always every part of the body. Usually you can break it down. Okay, thyroid and adrenals, and that's pretty manageable then. But then, we probably need to fix the gut if there's autoimmunity or a lot of inflammation. So there's also little tricks you learn along the way. So I've had great mentors. I was just thinking about this the other day. The mentors that I have had all kind of step forward when I was needing that part of my education. And
Mm-hmm.
it was like, when the student's ready, the teacher will come. And that's all
Always,
always just
always.
works so perfectly. Yeah, I'm looking back at my history and what I learned and all the things and when I learned it. And it's like now, back then it was just like random. Okay, I got to learn this and this looks interesting and I got bored with this, so let's move on to this. But it was all really perfect if you look back at the path.
Mm-hmm.
It's
And
totally, yeah, go ahead.
one of the things that I have appreciated about you, and as an empath, that our intuitive faculties are dialed up,
Yeah.
our feeling and intuition is heightened, and you also come from that space. When, at least when you've been working with me, it's not just straight up what do your labs look like,
No, no.
but you use a spirituality and an intuition to help guide in that process. And you're open to the woo. You're open to um a lot more things metaphysically and spiritually than a traditional MD.
Right.
And I really like that. You don't just go like, here, let me do some blood work and then give you antibiotics. You take the time to really investigate at a deeper level what is going on with the person. Like, there will be an online form that you guys have to fill out that's pretty extensive. It'll take
Yeah.
some time, right?
Yeah,
And
for some patients, we need a lot of information.
mhm,
Others are more simple, and I just don't know how to do it any other way. This is the way I've learned, and maybe it was to make up for learning disabilities I had, when I was younger, and so my brain went and formed other ways of figuring out things. And it's interesting now that a lot of times, obviously I'm thinking constantly, but sometimes even when I slow down or I'm not thinking for, that those few minutes, it just pops up what needs to be done. And I just usually will do it. And it's almost always right. But if I think it to death, try to figure out all this stuff and take things out, oh no, it's never going to work. And I don't have any success like that. Like changing your answers on a test. Uh,
mhm.
that was a tough one for me in school. I used to do that a lot before I had enough intuition that I could, I can't say it's not even that I'm using it. It's just there. It's a guide. That's all.
Yes.
It's a really nice guide.
And another thing that I love about going to your office is it's energetically so much cleaner than traditional medical facilities.
Good.
And I can feel like your spirit guide, so to speak, like in the space, blessing the space, blessing the patients
Wow,
that
giving me
come in to
chills.
see you. Like,
That's
there's
so
healing
cool.
angels and celestial helpers there that I can clairvoyantly see,
Wow.
that help.
Thank you.
And
Saying
and
that.
it's a beautiful office. I go to
Yeah.
the one in Fullerton, California, but you also have one. Where's your second location?
It's in Arcadia. It's in my home. I work out of my house in Arcadia. It's a pretty nice office. I mean, there's I practice Falun Gong, and I have for
Hmm.
22 years, and there's a picture of the master on the wall. And when patients are sitting underneath it, we'll be talking about something and they'll ask me some question and I mean, it's just a normal question someone would ask, but I look up at the master and it's like almost, to me, it's almost like, I don't know, sometimes I've said, well, of course that's the way it is. And just look up and they'll just look up at the picture and I'll be like, oh yeah, like they'll
Yeah.
just get it. Like it's like, am I gonna? I mean, it's not a question like, am I gonna live or something? But it's something along those lines, and I'll just look at and I'll be like, of course, this is where all the healing starts right here. This is a very powerful place, and you want powerful places like that. I mean, in one of the closets that's right down from the room. See, Tiffany loves the room. Can I tell them about the room you like?
Yes, I like the
Invented a
no
new kind of
stimuli room.
IV. Yeah. She likes the ghost room. No, just kidding. She likes the room where there's like no light and just she likes to be kicked back, like with the blankets above the floor, two chairs together. She like makes a train, like there's no alligators on the floor. She can't let her feet go down on the floor. No, I'm just kidding. I was just saying that to a patient the other day. Some other patient was in there doing the same thing. I was like, don't touch the floor. The alligators are there. Remember, you used to make trains with chairs and all the blankets? So
There,
much fun.
I just like going in that room and getting away from sensory
Yeah,
lights and sounds and just sitting there and receiving
that's so
my
cool.
vitamins in that way.
Yeah, I
It
figured if you figure that out, it must be helping you even more, and anybody can do that. They can have the private room as long as Tiffany's not there. Um,
I get first dibs.
yeah, Tiffany's supported me amazingly. She's done every treatment I've ever asked her to do. She came in with, sorry, I don't want to talk about her case online, but when she came in with something really hard to treat, and one day she smiled at the front desk. She didn't smile for 2 or 3 months. It was, I didn't know.
Yeah, so
I was,
I'll just share it. I had a bad concussion
mm,
and some neck and back pain from a car accident, and I had headaches like every flippin' day
right,
practically, and I was so sensitive to light and to noise, and there was so much pain and inflammation in my body,
yeah.
and all the different Western medical treatments, chiropractic, acupuncture, um, cranial sacral, pranic
Oh,
healing.
wow, you did a lot.
I did all that stuff prior to coming to see you.
Right.
And then I was guided when I did a search online a
Mm,
few different times for functional medicine doctors in my area, and I kept getting no, 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 this wasn't the right person, this wasn't the right person. And then I circled back probably a month after my last search and you popped up,
mhm.
and I knew I was supposed to go to you. And
Wow.
then we immediately started with different vitamin IVs and a few supplements, and we did like a exosome injections into
Yeah,
my
I remember
back, and
doing,
I
yeah,
just started to feel less pain and less pain and less headaches and less headaches and
yeah.
more clarity, and I could handle lights longer, um or
Well, you were
brighter.
so happy one day. I looked at you across the front desk and you had this giant smile on your face. And I didn't know, like, as the patients are so cranky and they're so sick, it's like hard to, you don't even know who they are. You even think that's who they are. And all of a sudden she smiled, I'm like, wait a minute, this is a vibrant, beautiful woman. I was like, wow, I can't believe this. And I was like, you're better. And I thought I just could see it. And I don't know if she had the makeup on. It didn't matter. The smile was just genuine. And that's the first time I saw you smile in like 2 or 3 months. And sometimes as a doctor, you have really hard cases. She had TBI. She had traumatic brain injury, which is really hard to treat. And I didn't know if what we're doing. I mean, I was hoping, and all the books would say this and that, but intuitively, I knew though, right?
Uh-huh.
Intuitively, but sometimes your brain would question your intuition. So I'm so glad that one day happened. It's just maybe there's like 3 or 4 people like this over the last couple of years. It's really just amazing. I don't know. That's what makes me love this job. What I
Yeah, I
do.
mean, it's hard, sometimes it's hard to smile when someone's in so much
Oh,
physical
I know.
pain.
I know.
And and I when I'm in work mode, doing healing and teaching and leading workshops, a different archetypal energy comes through me. And so I'm my natural, joy-filled, bright self. But when I was not in that archetypal energy and I was just like trying to do activities of daily living, I was
Yeah,
in so much pain.
yeah.
And so I am very grateful that I could, with, multiple treatments, I was able to get less and less and less inflammation, and so it was
You
really
stayed
helpful to me.
around, you let the miracle happen, you know. That's why I encourage everybody who's listening is to stick around. It may not happen overnight, and it's not going to be the first couple IVs sometimes, but the majority of my patients, pretty much no matter what they come in with, bar cancer and really serious stuff, 1 to 3 months is usually what, if they're not here, if they're not better in 1 to 3 months, then I'm going to refer them out to somebody else, or I just don't know what to do. And that's very rare. I mean, that may be 1% of my patient load. But if they can
Mhm.
stick around, and the IVs are amazing too, like even well, we do a very powerful IV. It's we used to call it the Myers, and then we changed it to Recovery Performance because I'm using 6 amino acids, 6 vitamins, 6 minerals, and 10 or 15 grams of vitamin C in every IV. So it's very, very powerful. And even that one, just for common colds and things, you think, well, how could that ever work? The vitamin C maybe, but it's just really amazing when you start doing those, and that replenishes. So other IVs like oxidative IVs, like ozone or high dose vitamin C or things like that will pull out, or chelation pulls out. So we have to have a balance of going yin and yang, going in, going out. And
Mhm.
the patient will usually tell you. So we do a combination of IVs for a lot of patients, and then we do the nutraceuticals. I'll do homeopathy a lot of times, peptides. And we even have, we have stem cells, and we have Wharton's jelly for injections. And I use a lot of the homeopathics from England. They come from United Remedies, especially for inflammation. You can put them right in the IVs. You can do anything you want with them. They're great. So it's a really powerful toolbox. I've learned a lot. As I said, I had great mentors that showed me.
Yes. And, anybody can get these vitamin IVs. You don't have to be quote unquote sick.
Yeah.
I mean, the the immune boosting IVs are fantastic year round. I mean, it's
Oh
use
yeah.
it preventatively so you don't get sick. Or if you're going to travel, get it before and after.
Yeah. Like
Bookend yourself
25%
with
of the
some
like
immune boost.
25% of the patients are coming in for just prevention and wellness. They're keeping in shape. They're really, they're not afraid, but they just want a vital life. They want to be vital. And
Mhm.
so many people I see, they can't absorb the nutrients that they're eating, their guts, their whole alimentary canal, all the way from, esophagus right down to all the way down is have a lot of issues, all different kinds of things, inflammation, candida, bacteria, just tears, I mean, all kinds of problems. So they can't absorb their nutrients. So when you give them an IV like that with 19 nutrients, and there's 3 cc's of it, like of each of those formulas, it's a lot of medicine, and they love it. I mean, they feel like, wow, and some say for a whole week, they just feel like that energy finally again, but they were just all these nutritional deficiencies that it's hard to measure. We can measure them, but a lot of times just one IV will take care of most of them.
Well, and explain to them why it's better to have it in an IV versus orally taking a vitamin or supplement.
Yeah. Well, I mean, just because it's going to digest, because when you do the oral things, as I was saying, if your gut is inflamed, if you have candida overload, if you have bacteria, have parasites or any of that, or your pancreas isn't letting the digestive enzymes go, your gut, the pH isn't low enough in your gut, and it's not calling in the bile when you digest fats, or you don't have any bile, you don't have a gallbladder, all these things will influence your digestion. And that's just the beginning of it. And then it actually has to get into the cell. So what happens if the food, the body doesn't break it down, it's going to go into the blood undigested. And if one single particle isn't digested down to the last molecule, the body's going to think it's an enemy. So that's when you really start the autoimmunity from the gut, leaky
Mhm.
gut syndrome. And that's what starts so it just starts as indigestion, then it goes to leaky gut syndrome, then it gets worse and worse and worse, unless you fix it. And a lot of people are
Mhm.
getting smarter, but just taking out gluten and dairy, a lot of times that can help. But usually we do a lab, we can see all the different foods that you're allergic to, or say sensitive to, because they're not true allergies. per se. Then you don't get anaphylaxis when you eat them. It's not an IgG reaction, it's an IgA or IgG reaction. So we'll pull those out in the beginning and we'll start to fix the gut. And they're like, what do you mean I can't eat all these 27 different foods? I'm like, for a while, but once we fix your gut, once you stop drinking what are they called? Those drinks that give you energy, those monster drinks. Once you stop drinking the monster drinks and get, maybe you can do a little meditation and get some relaxation in your life. It's not like, you're a human being, not a human doing. Everything isn't on all the time. Just to try to relax them, because you got to relax. Remember, parasympathetic is what you should be in all the time. Rest, relax, digest. So how do you get into parasympathetic? Well, you got to start doing a lot of different things. Eat right and meditation. Maybe being nicer to people, because when you're compassionate to people, you're not giving them the finger when you're driving or yelling at them or cursing at them, whatever. Even if it's under your breath, you're still taking on a huge karmic load. I can tell you, because I'm very sensitive, and from practicing Falun Gong now for 22 years, it's about giving up your attachments. So if I was to yell at somebody, I just didn't give up that attachment of anger, and it would all come back. Not all, but a lot would come back. I would feel sick instantly. I'm a barometer for energy, so I know.
Yeah, whatever we give, this is the universal law. Whatever you give, so shall you receive. And it comes back tenfold
I know.
for the average person.
It'd be
And
really well
and
for
if you
people that.
send a negative energy to someone who has like a big, strong aura, perhaps they do a lot of meditation or qigong or tai chi, and the energy comes back like 100-fold.
Yeah,
So
it can
you
be
want to
really
be
bad.
sure
Yeah,
to think positive thoughts towards
yeah,
especially people who have bigger, stronger auras. um, so a couple of other questions. I know you've got the two offices, but can you also help people via Zoom if they're not local?
yeah. I do a bunch of Zoom cases here. I went to Bark. I don't know. They just sent me an email. I don't know if you know what it is. It's kind of like an online. It's more for counseling and like for bereavement. I can do really well with homeopathy for that. I mean, I don't take on like hundreds of bereavement cases, but I can do that. Or self-esteem, or I mean, I went through a lot to get to where I am. I think all healers have gone through amazing tribulations and triumphs over those tribulations, breaking down steel walls instead of going around them constantly. Well, that takes a lot of work and a lot of, I've been given a lot of gifts, and I've been given a lot of the mentors. I mean, Carolyn Miss was one of the first things I ever read, Wayne Dyer. That's how I
Yes.
started. And then I just went, and then, when the student's ready, the teacher will come. So I kept getting pushed to a different level and getting more and more responsibility. So yeah, and then anyway, I can definitely do Zoom consultations. I do at least, I'm playing with my computer here. Sorry. Okay. I do one or two a day usually, and the patients can be anywhere. We can ship things to them. A lot of times I'll find IVs in their area if they need IV therapy. So yeah, we can do lab. The
Nice.
lab work, I have a really nice panel now, and Quest is actually part of the lab company that I'm using, but it's not Quest prices anymore. But we can use all their labs and all their draw stations. It's
Nice.
actually Cleveland Heart Lab, and they're well, they're very reasonable, and they have a huge array of, especially of heart, vascular, and stroke or brain labs that I emphasize quite a bit. It's 50% of the about 15-page lab report. We're doing about 60 markers, looking at all the inflammation, looking at the vascular issues, looking at all the fats a little differently, all the hormones, and plus your regular labs that the regular doctors are doing, your fatty acids, because you can see what the patient's, you're made up of what you eat, especially with fatty acids. I can look right down the line. And if arachidonic acid is like off the charts, then, you're eating a lot of meat or a lot of inflammatory foods. We can tell a lot from that, especially with the diabetes, insulin resistance. We want to catch that early. We don't want people getting hemoglobin A1C of 8s and 9s and getting on, insulin, and it's just it's a downward spiral at that point. You don't want to do that. We can fix that, but it's harder. It's much harder and takes longer and costs more money too.
Mm-hmm. So talk to me about all the give me more examples of why people would come to see you. What
Sure.
do you help them with?
Well, one of the big ones, because I didn't really want to just treat pathology my whole life. It's hard. It takes a lot out of you. So I started about 10 years ago. I guess it was just kind of given to me. I could see a lot of the things I was doing was making people look better on the outside from the inside. And I know for myself, whenever I started working out after, say, I used to party a lot and I'd be drinking and all of a sudden I'd wake up one day and, oh my God, I'm going down a downward slide. I'm not going to do this anymore. And I would stop for like 2 or 3 weeks. But at the end of those 3 weeks, before I went and started doing it again, I looked like a model. I mean, it was so great. I could get literally my muscle, I could get, water in my body. I wasn't dehydrated. Just not being dehydrated makes you look really good. So internally and then externally, we started doing a number of different treatments, some facials with exosomes, microneedling with exosomes, and then some of the patients want to do even more. So we inject Wharton's jelly and very strategically for the bags under the eyes and forehead wrinkles, much safer and much more genuine holistic than Botox. You got to be careful with Botox because it's a very potent toxin, one of the most potent toxins on the earth. I can tell you some stories in France, what happened with vichyssoise soup. It wasn't cooked and had botulinum toxin in it. Like
Mm.
no one survived. I mean, it's really strong stuff. So anyway, we do that, and we're getting a few more machines. We're gonna bring in some IR light machines, and for everything from acne to wrinkles and skin tone, smoothness, basically regenerating the skin. We have a new magnetic machine we're bringing in a few weeks. Different things. We're going to get a hyperbaric oxygen chamber soon. So all this
Yay.
about 2 months, I think about 2 months down the road for all these new things to come in. So yeah, so much more external plus internal. That's kind of the thing I coined a long time ago. And really looking at that, what do you need to do? Vitamin C IVs, glutathione IVs. A lot of the Asians like glutathione, it makes their skin whiter. They want to have whiter skin. They can do glutathione. But we also have a cream that will do that too with exosomes in it. I have a cream, I have a serum I developed myself with everything but the kitchen sink in it. I mean, they're really potent things. There are a lot of, hyaluronic acid and it's many different ingredients. Glutathione, I think it's B12, vitamin C. Then it has some the exosomes. So what I take a lot of times, I won't use all the clear gel that we mix with the exosomes because the exosomes are lyophilized or powder. So I'll have a lot of those left over. So I'll use that in the serum, and it has all these amino acids and peptides in it. Then we add more exosomes to that. We use the lightening creams for the creams. So it's very diversified. For every person, there's definitely a way to do it. And everybody's different. Some are really working out great. I can help build muscle. I can burn fat very easily with peptides, semaglutide. Testosterone for men and women. I use testosterone, sometimes fairly high doses for women. They're loving it. They're gaining muscle back. Some of them I have one now. I have a 50-year-old principal, and she's
Wow.
6'5", like 220. I say, I will never go up under the boards against you, that's for sure. I mean, she's really in good shape, but she let herself go for a number of years. And I said, what do you want to do? It's funny. I said, when they first come in, I said, what do you want to do? And some of them kind of look down and then, well, I want to do like a triathlon. I was like, what do you want to do? A triathlon? Yeah, well, there's no way I can do that now. I'm like, yeah, well, just wait. I'll fix that. Because I love those patients because you can crack the whip on them because they want to do it. That's their, she just wants to play basketball better again and help coach the kids. But a wonderful principle that we have here. All my patients are great. So yeah, so there's that. So the anti-aging part of it, functional medicine. I do a lot with thyroid. Okay. Thyroid patients are getting destroyed because they don't know that their labs are bad and they think their labs are normal because no one ever really takes the time to go through the labs carefully with them. I guess the doctors are too busy or they don't know. But with thyroid, we do 7 thyroid labs. Okay. If you don't, you can't really see what's happening to your thyroid. And if your thyroid is at all off, even if it's subclinically not correct, you're going to be exhausted, your hair is going to be falling out, you're going to be depressed, you're going to be angry, your blood pressure is going to go up, your menstrual cycle is going to be extended, it's just all these symptoms. Thyroid controls all the symptoms that you feel in your body. Like you're
Hmm.
not going to die from a low thyroid. I mean, if it's really low, you will go into a coma, but it's very rare. But even just a few points off, you just feel horrible. And a lot of times what I see, not most, but many of my patients are menopausal women, and they've been doing pretty good. They're holding it together. matriarch of society, working, they're keeping the husband in check, they're balancing the finances, their kids maybe grown up, but they're still helping the kids, right? And all of a sudden menopause hits. Oh my goodness, that's just the last straw. That's so hard for them. And I don't blame them because I've seen those symptoms. Luckily, I don't have them, but I know what they suffer from and I have big empathy for them. So those are my warriors that I get back out there, and I get them out there as a warrior, literally, with no problem and ready to fight, or not fight, but just go into life and be part of it
Mm-hmm.
again and do really well, even better, because the brain fog will clear that out. Low testosterone for one part in men and women, you're going to get weepy. You shouldn't be, you don't understand it. You think, oh, those are just all sad movies, but every movie isn't a sad movie. Neither is the 7 o'clock news, right? So if
Mm-hmm.
you're weeping for all these things, and then the other big thing with testosterone, you can't make decisions.
Mm-hmm.
So that's so hard to live like that because you're never sure, oh, is that correct? Like you can't use your intuition very well. So I like to balance the hormones, and we only use the BHRT, the bioidentical hormones. We never use anything else. Then we'll add something to raise the IGF-1, so your growth hormone. I won't use growth hormone very often unless the IGF-1 is really low. Usually we use a peptide like ipamorelin, semirelin, and just these few things with a few IVs. I mean, you can change someone's life. You can really change it. But the thyroid and the hormones, you need to target them and you need to know what you're doing, or else you're going to give them a lot of trouble. You have to be able to target those and understand not so much what the medical orthodoxy is telling you, but what your experience has been and what some of the functional medicine doctors like A4M would be teaching a lot of the things that I do. I love A4M. I go there, the Anti-Aging Society of America. I go there every year in December. It's coming up. It's a wonderful time. It's a Palazzo Hotel in Las Vegas. It's 4 days. It's like 100 classes. There'll be 1,000 booths there in the one room. All the aisles are never ending. You never get to see everything in there. And there's Christmas trees, lights. It's just a beautiful time. And we learn so much. So those are the kind of things A4M is teaching. And I
Mm-hmm.
think a lot, well, with our naturopathic schools are teaching as well.
Yeah, you often go to different seminars to just keep up leveling your education.
I
I
love it.
I remember after I saw you, you went to a TBI conference and came back and was like, "Okay, I have some more stuff for you." You know,
Yeah, of course. I
it was
went,
great.
there was a Great Plains lab with Dr. Bredesen. Dr. Bredesen is the only doctor in the world that's figured out how to fix Parkinson's and I said Alzheimer's, I think Parkinson's as well, but definitely Alzheimer's, and has research and not using a single drug. And he actually shows at the beginning of his work, here's what the drugs do, and here's what our research did. It's like hands down
Wow.
completely different. And it takes a lot. And one thing that I realized when I saw this, it was Great Plains Lab did this 3 day seminar, and it's all about brain. It was genius, and about um, uh, what do you call it? Mold toxicity. It was just a
Mm-hmm.
wonderful lecture. But I just went through Dr. Bredesen's lecture and picked it apart. I literally had 75 pages of notes from that 3 days. I've never done that in my life. And Bredesen's lecture, I had like 30 or 40 pages just on that. So I broke it all down. I tried trying to do it. The problem I ran into is that it's so in depth that patients, they don't want to, especially if they have Parkinson's, they don't really remember how to do things. It's hard for them to do.
Mm.
So you have to break it down little by little. But there is a way to treat Parkinson's and Alzheimer's especially. So
That's wonderful that there's some alternative approaches, not just the, well, you got it, go try to live the rest of your life as best as you
yeah,
can. But,
it's tough.
according to Western med, it's pretty
Mm,
much untreatable.
exactly.
And here, within your community, you're like, wait, there's actually some great things that we can do.
Yeah. Well,
And
there's another one. I just going to join a group of doctors who actually have clinics in Colombia and Costa Rica who are doing a lot of stem cell IVs, and they're able to expand the cells. They're here. The FDA says you can only use them as they come out of the placenta. You can't expand them. So they're strong. Anyway,
mhm,
we're not allowed to do any of that here, IVs or anything like that. But down in there, they're expanding them to 150 million cells. And I just talked to him this morning. I talked to the owner of the company. So, and then type 1 diabetes, and I questioned this 3 times. I made sure they have people completely off insulin with type 1 diabetes, because the
Wow.
pancreas is woken up by this huge mass of stem cells, and the islet cells in the pancreas start producing insulin again. They're not dead. They never were dead. They're senescent. They're quiescent, senescent. But according to, like, even to me, they're not working because I don't have anything to wake them up. And now these clinics, if you're doing these different stem cell IVs, have documentation on that. And a lot of the autoimmune, the really serious lupus, Crohn's, it's MS, they're fixing it completely. So it's really, really, it's like stuff that we never thought we could treat. So if anybody's interested in that, please let us know. We can guide you to these, and you can talk to the doctors down there. I'm just a referral. That's all. They all tell you if your case can be treatable or not, and they'll show you the genetics of all your cells. They have people working in those areas from the hospitals and from the universities have joined them. So,
Mm-hmm.
because there'll be people that probably don't think this is going to work or don't like it. They have to have all the documentation. They're very careful, and their credentials are really good. So,
So here's the message, people. If you're not feeling energetic, healthy, slender, athletic, the way that you want to look and feel, set up a consultation with Dr. Dana, either in person or over Zoom. And if you've got something that's rare or hard to treat, set up a consultation. See if there's something that he can do or refer you to, because he's a wealth of information. And by the way, he's gifting you free access to his wellness library at drdanachurchill.com, drdanachurchill.com. And your regular website is
correct. Yeah, I have
thechurchillcenter.com.
two websites. I just haven't, I mean, some people want me to take one down, but I don't think I will. Another thing, I do have a book. It's not, actually, I'm really lame with IT stuff sometimes. So it may even be an ebook. I think it is an ebook, but I have the hardcover books here. So if anybody wants one, they're free. It's basically the story of my life, how I healed and how I found complete, really peace. I mean, because the one thing 20 years ago or 22 years ago, the one thing I can say is I had no peace and serenity whatsoever. I didn't even know what it was. That's the only thing I wanted. I didn't care
Mhm,
about money, prestige, power, relationships, marriage, kid, nothing. I just wanted to find peace. And when I practiced the meditation Falun Gong, I found that within 3 months. It was the most amazing thing. So then I could start to live my life and amass all this knowledge. Because when you're sick, you can't do anything really. It's horrible. So
mhm,
I got that solstice. Now the physical body changed too. So I can't say enough for, that at least I don't know any other Qigong's or Tai Chi. I've seen people doing them, but a lot of those Asian types of exercises are just amazing. Get out there. Don't be afraid. There's people in the park waiting to teach you. They won't charge you. Take them out for a coffee, buy them some Chinese
mhm,
food. They're just wonderful. Once you have trust in them, they'll stay with you your whole life. They're such good people. They're not worried about life or money, or they're just living their life. It's really
mhm.
amazing. Thank you,
Yes,
Tiffany. Thank you so
my
much.
pleasure. Thanks for helping me directly. Thank you for the help that you're going to bring to my clients who are listening to this. And I appreciate you and your friendly, wonderful office staff.
Thank
And
you.
Ophelia, who is the nurse
Yeah,
on staff.
she's great.
Um,
Yeah.
I only I'm a hard stick, to get
Yeah,
like IVs in, but she miraculously does it,
yeah.
and
She's a
less
good one.
painful than other places.
Yeah.
So
Yeah,
I
we're gonna
I
give
like
her a
her a
real
lot.
challenge next Thursday. We had last week, we couldn't get it. There's two young women that were really sick. Anyway, she's gonna get a chance on Thursday to see. Hopefully we can get it in. That was the only
The
time
Ophelia magic in
yeah,
the office.
exactly. It's a good one. She's so peaceful and happy too. I like that. That's what
Yeah.
we want. That's what I screen everybody, even the people, the companies that are working for me. I mean, if I have to work intimately with them, I want to make sure I call them good heart people. And
Yes.
I just want to screen out or vet who I'm working with. I don't want any bad energy around me. I've
Mm-hmm.
chosen the wrong people a bunch of times, and usually within the 2 or 3 weeks, they just leave on their own accord. I don't know. The energy is pure here, and how do you get pure energy? People are listening to this. I don't know how to explain it, but you just do good deeds and you think of others. And like our practice is a Buddhist-based practice, so you try to get out of yourself, and that kind of reverberates around, and that's the kind of people you get. And hopefully, all the patients you get are like that, but not always. So you got tests too. You got to be
Mm-hmm.
tested, right?
Mm-hmm.
So, but it's a wonderful. I love what I do.
Yeah,
So,
like you bring Eastern and Western together
yeah,
in your comprehensive approach.
for sure. Yeah, I can agree with
So
you.
thank you for all
Thank
that
you
you
so much.
do. Have a wonderful rest of your week and
Thank you, Tiffany.
namaste
Thank you
and
so much.
much love to everyone who's listening. Bye
All
for
right.
now. See you
Bye. Have a
next
great
week.
day. Thanks, Tiffany.